Welcome to Thermography Medical Clinic's webinar series. Today, I'm going to be talking about having a full body thermography study and why everyone should have one as part of their annual physical exam. My name is Sharon, and I am a registered homeopath, a holistic nutritionist, and a medical thermographer. I am the founder and clinic director of Thermography Medical Clinic since 2010. I am an interpreter for Thermography Medical Clinic. I was the clinic founder and director of Divine Living, which was a natural health clinic from 2005 to 2022. My philosophy is a personalized, proactive, and preventative approach to healthcare. My philosophy as a practitioner: thermography as a health discovery tool. Look for the cause, not a diagnosis. Treat the cause, and you'll heal the patient. A full body thermography study is a complete health assessment, and a full body study provides a comprehensive health evaluation which can help the patient to identify inflammation in the body and the underlying cause of that inflammation. Follow-up thermography studies monitor the progress of the patient. Are they getting better or worse? And is the treatment plan they are on actually working? For people who are proactive about their health, thermography identifies physiological changes such as early signs of inflammation or congestion and even musculoskeletal issues. For people who have an already existing health concern, thermography can identify signs of active inflammation, identify areas of concern that may require further clinical evaluation or correlation, and identify the source of the problem. Having a full-body thermography study can aid in the implementation of an individualized treatment protocol, and it can be used as a test to assess and evaluate if a treatment protocol is effective. As a practitioner, this is the easiest way to assess the health of your patient. Many practitioners rely on their patients to answer a questionnaire. We know that patients often leave out important information, or they think that parts of their history are not important. Tests such as blood work are not very sensitive and may only reveal imbalances when the patient is in a diseased state. Structural tests such as X-ray, ultrasound, and even MRIs require one to know the general area of the body you are looking at and what you might be looking for. These tests don't typically reveal the cause of the problem. The best test, in my view, is thermography. It is non-invasive and can be repeated over and over without causing harm to the patient. While thermography does not diagnose disease, it is the most valuable assessment tool because it allows you to see inflammation in the body and the source of that inflammation. Thermography doesn't diagnose any condition, and there are no thermal patterns that are specific to a certain disease. If someone has fibromyalgia, we aren't looking for thermal patterns that confirm the condition. We're looking for thermal patterns that may indicate the cause. I like puzzles, and what I like the most about puzzles is when I am able to put all the pieces together. So let's take a look at a few different case studies that will show you the role of thermography in identifying the underlying cause of a patient's complaint. This patient reported chronic joint, muscle, and all over body pain. So let's take a closer look with thermography and see if we can uncover the underlying cause of her symptoms. This patient came in and reported concerns related to frequent headaches, neck, upper and lower back pain. She stated that she was stiff all over and had severe muscle aches. She consulted with a structural therapist who believed that it was a misaligned spine. So she'd been having regular chiropractic and massage treatments with no relief. She also complained about severe breast pain and difficulty breathing. No other concerns were reported. So the findings in her thermography study indicated the following areas that needed attention. She needed to pay attention to her digestive system, the liver, and the adrenal glands. There were really no patterns that indicated imbalances related to the spine. So I concluded that her musculoskeletal pain had a deeper underlying cause related to the condition of her digestive system and due to her nervous system being stuck in fight or flight. Let's take a look at her images. These are her initial images. In her head, there's evidence of inflammation around the mouth, which indicates dental inflammation caused by teeth clenching. We know that teeth clenching can be the result of stress, or it can be a symptom of bacterial imbalance in the body. In the lateral and posterior neck images, there's a lot of inflammation related to lymph congestion. And in the upper back, They are irregular or misshapen patterns that indicate soft tissue inflammation caused by lymph congestion. In the chest, those branching and scattered patterns also indicate inflammation caused by lymph congestion and adrenal stress. Lymph congestion indicates that the body is having a hard time keeping up with toxins in the body. In these images, the patterns in the breast indicate inflammation related to lymph congestion and toxins in the body. In the abdomen, those patterns indicate significant inflammation caused by adrenal stress and bacterial imbalance. The lower back also shows soft tissue inflammation caused by lymph congestion, and those last trunk images give you a very clear picture of how much inflammation there actually is. The patterns in her hands are normal, and in the lower extremities, she has some circulatory issues likely due to those varicose veins. So my priority was to address the overwhelming inflammation that this person had. It's really important that people understand how stress impacts their physical health. Without this knowledge, people don't recognize the importance of supporting their body during stressful times. I realize we can't eliminate stress, but we can support our body so that our physical response to the stress takes less of a toll on our health. After discussing the findings in the thermography study, I learned that she had been going through a very stressful time related to work and her home life for well over a year. We talked about how the body being in a constant state of fight or flight leads to inflammation in the body. Chronic inflammation keeps the immune system on overdrive, and this leads to long-term unresolved stress on the body. It drains the capacity of the immune system to deal with other stressors. Chronic inflammation disrupts the gut flora and ultimately makes the body toxic. This causes even more inflammation, and the cycle continues until the cause of the inflammation is addressed. So while it's important to address inflammation, it's critical to resolve the underlying cause of the inflammation, and that is exactly what we set out to do. The treatment protocol focused on reducing inflammation, supporting the adrenal glands, calming her nervous system, supporting the liver, and addressing the bacterial imbalance in the digestive system. If you want to know more about how I design my treatment protocols, you can watch my webinar called the 4 R's. In this webinar, I talk about the methodology that I use to help my patients return to health. We started the treatment protocol with this patient, and let's see how we did after 1 year of working together. This is why I love thermography. If you can't see it, you won't believe it. But if you can see it, you will believe it. So was it a success? The first row of images are the initial images, and the second row is the follow-up. I'm hoping that visually you can see the change in the images. The dental inflammation is no longer there. The inflammation in the lateral neck caused by lymph congestion is no longer there. You can see in these images, in the posterior neck and the upper back, that there's a significant improvement. And in the chest, those branching and scattered patterns, they've also gone away. In the breast, there's also a significant reduction in inflammation. And look at those abdomen images. All of the inflammation is gone. The positive results continue to be observed in the lower back and even the trunk images. The hands were normal to begin with, and so the follow-up images are the same. And we can see the same thermal patterns in the legs in this follow-up study. Those vascular patterns are varicose veins. So follow-up study findings. What do we see? How does she feel? We see a significant reduction in inflammation, and as a result, she feels so much better. So if you're struggling with unresolved musculoskeletal issues such as chronic pain, I encourage you to look for the source of the problem with thermography. The conclusion is this patient's musculoskeletal complaints were not caused by imbalances in the musculoskeletal system at all. Rather, they were caused by inflammation in the body. The prolonged emotional stress led to an overactive nervous system, which led to dysbiosis, bacterial imbalance in the digestive system, which then led to an accumulation of toxins in the body, which then led to chronic inflammation, resulting in her chronic pain. Let's take a look at a second case study. I call this one organ dysfunction from another cause. So this patient came in complaining of chronic sinus issues. She had also complained of right breast chest pain. She had a mammogram with negative findings, and she also had heart testing to rule out the chest pain. She has constant pain in her left groin area and worries that has something to do with her intestines. She has thyroid disease that doesn't respond to medication or any other kind of treatment. She has urinary incontinence that's ruining her quality of life. She does report in her history that she was in a serious motor vehicle accident 10 years ago, but claims that she doesn't have any musculoskeletal complaints at all. So let's take a look at what her body is telling us. These are her initial images. I will talk you through them. In her forehead, around her eyes, she has a lot of heat, which indicates sinus inflammation. That's something she complained about. Around the mouth, there is some warming that indicates dental inflammation caused by teeth clenching. There's a small hot spot over the thyroid related to thyroid inflammation, which she also complained about. But most notable to me is the inflammation in the back of her neck, and on the right side, and in the lateral neck on the right side. Did you know that chronic sinus issues could be caused by lymph congestion due to a strained cervical spine? This is a key finding for this patient. In the upper back image, you can see that I added an overlay in the first image to help the patient understand what was going on. I made a circle over an area of the spine that is colder than it should be. This indicates discompression, and discompression in this area could be the cause of the thyroid dysfunction. Also, in the upper back, there's muscular inflammation on the right side. This could be causing referred pain into the breast and chest. In the abdomen, there are patterns that indicate inflammation in the digestive system. In the lower back, that focal hotspot at the bottom of the spine indicates disc inflammation. An imbalance in the spine in this area would cause referred pain into the groin, and it could be the cause of her urinary incontinence. The breast images are pretty normal, other than some mild inflammation, which is likely caused by the unbalanced upper spine. And in those trunk images, you can see how hot the hands are. This indicates cardiovascular stress caused by an overactive nervous system. The nervous system can be activated when there is injury or even when the musculoskeletal system is out of balance. The images of her feet also indicate cardiovascular stress caused by an overactive nervous system. So we have a few things here to focus on. The findings in this study indicate sinus inflammation, which we knew she had because she reported that, adrenal stress, and an unbalanced digestive system. We need to pay attention to these areas. But most notable to me are the imbalances in the musculoskeletal system, the cervical spine, that discompression in the upper back, muscular inflammation in the upper back, and that disc inflammation in the lower spine. My treatment protocol. I recommended a few supplements to reduce inflammation, to improve the state of the digestive system, and I wanted to support the adrenal glands. But most importantly, I referred her for a musculoskeletal assessment by an osteopath. She also started exercising under the direction of an exercise therapist and a kinesiologist. She came back 6 months later and reported the following. Her sinus problems are no longer an issue. She has no more breast pain or chest pain. Her thyroid levels are within normal range, no more groin pain, and the urinary incontinence is resolved. She's had a miraculous transformation. Again, seeing is believing. Let's monitor the progress and let's take a look and see how this patient did 6 months later. Here, you can see the initial and the follow-up images. These follow-up images show a significant reduction in inflammation related to the sinuses. The previously noted hotspot over the thyroid is no longer there, which indicates also an improvement in her thyroid function. In the posterior neck, there is also a significant improvement in the amount of inflammation that there was on the right side. In the lateral neck on the right side, the muscular inflammation is no longer there. In the upper back, there is also a reduction of inflammation related to the muscles and the soft tissue. There is still some mild discompression, and in the abdomen, there's less inflammation related to the digestive system. In the lower back, there's also a significant improvement and a reduction in disc inflammation. In the breast, things remain mostly consistent. There's still some inflammation in the axillary regions related to lymph congestion. And in these trunk views, you can see the difference in the before and after. So much less inflammation and such an enormous improvement. Remember the feet? The change in the toes from hot to normal. In the hands, the patterns are mostly the same, which tells me there's still some underlying work to be done in terms of supporting the adrenal glands and supporting the cardiovascular system. So what's the conclusion here? Her complaints, sinus issues, thyroid dysfunction, the chest and the breast pain, the groin pain, and the urinary incontinence were caused by imbalances in the spine that she wasn't even aware of because she didn't have symptoms related to the spine. Thermography helped her identify the underlying cause of her concerns and monitored the progress of her health journey. So why don't you let thermography help you? Thermography used in clinical practice as an assessment tool takes the guessing out of what might be wrong by guiding the treatment plan and monitoring the process. Are you concerned about your health? To learn more about how thermography can help you, the following videos are available on our website, thermography.medicalclinic.com, and our YouTube channel. For more information, you can visit our website, thermography.medicalclinic.com, and follow us on Facebook and Instagram.